States and cities across the country are lining up to hold big pharmaceutical companies and their executives accountable for the nation's opioid epidemic.
New government data shows an alarming number of pain pills coming here to Colorado. And tonight, Chief Investigative Reporter Tony Kovaleski takes us inside the public battle to reverse the opioid crisis in our state.
Like the impact of the pills, the numbers
45, 50
are numbing.
The opioid epidemic is not over.
Data from the federal government shows more than 1 billion prescription pain pills came to Colorado during a 7-year period.
We're not anywhere near a downturn.
Lisa Gawanis should know. At Denver Health, she treats patients with opioid addictions.
Healthcare professionals are getting it. It's really the illicit drug supplies that continue to fuel our epidemic.
Let's walk you inside the numbers to show you how these pain pills have covered every corner of our state. From 2006 to 2012, pharmaceutical companies sent 53 million opioids to Douglas County, 140 million to Adams County, 189 million to Denver County, and Jefferson County led the metro area with 210 million opioids during those 7 years. Pain pills that contributed to nearly 1,000 overdose deaths in Colorado just last year.
I mean, one person dying is enough, you know, but to see the pattern, and it's not just here, it's all over the country. I mean, something has to stop.
Renee Goebel has worked to create that accountability. As assistant city attorney in Denver, she's leading the city's lawsuit against Big Pharma.
They are no different than any other drug dealer on the street. In fact, I think they're worse.
She's well aware of the 188 million opioids that government records show were handed out in Denver between 2006 and 2012.
Denver wasn't necessarily as bad as some of I think some of the smaller rural counties in other areas, but it's still a lot of pills, 30-something pills per person.
People's lives who've been ruined, people who've lost their jobs. I want to help people recover from this crisis.
Colorado Attorney General Phil Weiser is also looking for accountability. He and several other state AGs are also suing Big Pharma.
I want to get the money from this settlement and use it to help both prevent on the front end, but also help treatment and recovery so people can get their lives back together.
Attorneys general across the country have obtained hundreds of emails between the big pharmaceutical companies and their pharmacy suppliers. They say proving Big Pharma was putting profits ahead of public health. This exchange from 2009 between opioid maker Covidien and supplier KeySource was particularly revealing. Keep them coming, flying out of here, says a KeySource sales rep. It's like people are addicted to these things or something. Oh, wait, people are. The response from the pharmaceutical company, just like Doritos, keep eating, we'll make more.
It's really clear. They saw a money-making opportunity. They said, we can get people to take a whole bunch of pills, and they targeted doctors who'd overprescribe. They told people it was not addictive when they knew it was because they could make money. They wanted to make money. They didn't care about the consequences.
So here's perspective. Denver Health saying because so many opioids are sitting in medicine cabinets and still on the streets from the years of overprescribing, they don't see the impact slowing for years. But the hospital is pleased to report prescriptions for opioids dropped by more than 10% in the 2 most recent years. I'm Chief Investigative Reporter Tony Kovaleski.